Welcome back. There has been a lot of debate lately about states reopening. Is it too soon? Is it too late? In Vermont, Governor Phil Scott likes to use the term turning the spigot as the state takes a slow and steady approach to getting back to business. We are joined now by Vermont State Health Commissioner Dr. Mark Levine and Claudio Fort, the president and CEO of Rutland Regional Medical Center. We are working on getting Dr. Levine so we can see his face, but Mr. Fort, we will start with you. In Rutland County, first of all, this is something, as we said earlier, that you only planned for, never expected to actually, put that playbook into use. How did it work early on?
Yeah, and even our plans, Lauren, that we had rehearsed and done and so forth, we had planned for, something of a lot shorter duration. But our plans worked really well. I think, fortunately we're in Vermont, and as Vermonters will do, the people who worked at this hospital, everybody pulled together, and there was no full playbook on this. And so we were making it up as we went along, and we were moving really quickly to try to prepare our hospital, protect our staff, protect our patients, and make sure we were available for the community should we have the worst case scenario. So we were doing things that would typically take weeks in a matter of hours or days, literally. So, I think everybody pulled together. We did have a basic plan, so that was incredibly helpful in helping us to organize our resources.
Rutland County had a surge site of 150 beds staffed by your hospital, and you never had to use that, correct?
That is correct.
Okay.
Yes, we worked closely with Vermont Emergency Management, the governor's office, to get this site up for Rutland County in the southern part of Vermont. And we are ready. We still have it staged up in case we have another surge. But fortunately, we didn't come close to having to use that.
Do you have any hospitalizations right now, sir?
Currently, no.
Okay. In one of your initial emails back in March, the hospital had received PPP early on. Was that ever a concern for you then that so many other organizations had to deal with? We heard these horror stories in other states, especially New York. So how did you manage to work with that equipment?
Yeah, with, we early on, our supply chain folks really tried to be proactive. As we started to see and hear what was happening, we started looking at Northern Italy, and then we started seeing what was happening in Seattle, Washington, and Washington State. So we had, some advantage of seeing how this was starting to play out. And so we tried to secure as much PPE as we could. We had some local companies come to the rescue and donate some of their PPE for us. And then our clinical staff and our infection control folks worked really early on in trying to put in place proactive PPE conservation strategies so that our staff, and we were assured that they would have it when they needed it. My biggest fear was that we'd have some of our clinicians intubating people, putting them on ventilators and intubating them with handkerchiefs wrapped around their necks and faces. And fortunately, we didn't come close to that.
Okay. Mr. Fort, we are going to bring in Dr. Levine. We do have his audio, so that works well. Dr. Levine, really appreciate you joining us tonight.
Thank you.
I do want to start with the Winooski cluster that you are now calling an outbreak. I know at 11 o'clock today in the governor's press conference, you only knew so much as you just learned about these 10 to 20 additional cases. Is there anything you can tell us tonight?
The team has been working on that all day long. I don't have final numbers for you at this point in time. We're again reviewing all of the test data that came in, and there's more test data coming in on a daily basis. Suffice it to say, the number will be greater than the original number we started with last week.
I know you've been asked this question too. Is this one family, or is it related to, a number of people going to one place? Is that anything you can release yet?
I honestly can't, based on the fact that the contact tracing is in progress and the interviewing is all in progress. I can say, though, that it is a community outbreak, if you will, and it's not within a specific facility in the community.
Okay, and it's then more than just one family too.
Yes.
Okay. Sticking with contact tracing, of course, when it comes to these new infections that we're learning about in the past few weeks, in part of the investigation process or in contact tracing, do we know how many are essential workers or how many have by and large been at home? Is that information you're after right off the bat, and how does that guide you?
For contact tracing, let me start from the beginning. You get a positive test result, you interview that person, and obviously provide them with instructions regarding isolating themselves, making sure that they have all the essential services that they're going to need to make isolation successful. You then ask them to go back in their history, and now we're asking them to go back 14 days to try to figure out if there were numbers of people who had sufficient close contact with them and for a sufficient duration of time that contact could have meaningfully turned into a true exposure and put them at risk. So every person we interview, obviously, we need to know their capability for isolating, their capability for what we would term quarantining, which is what the contacts would be doing, because unless they have symptoms, they are asymptomatic and at risk. And obviously, we need to know what support they need so that depending on what their career has been, what kind of obligations they have to family, if they're living alone and without anyone to help them out, because they have to clearly eat and drink during this period of time, and they may need other services like delivery of pharmaceuticals and things of that sort. So it's a very history-taking process. In terms of being able to tell you at this point how many of the countless contact traces were essential workers or things of that sort, I'm not sure I could go to that level of detail. No.
Does that worry you, though, if some of the new cases are people that have relatively been at home?
I'm not sure I understand what you mean.
I guess, or is the information guiding you when it comes to an essential worker or somebody that really did try and pay attention to the guidance and stay at home?
Oh, sure. So it doesn't worry me, but I mean, it's obviously a piece of the puzzle that we're very concerned about knowing. Essential workers, are not just healthcare workers. They span a whole variety of occupations. And we do want to know exactly how we can help them. But at the same time, we're very concerned about the work site that they are now not allowed to return to, and making sure that we're protecting that work site so that if there are other individuals who would have had the same risk, that we can deal with that quickly.
According to case demographics, African American Vermonters have the highest rate of contracting COVID. We have heard about this virus disproportionately affecting people of color around the nation. What has that taught you about reaching out to the communities in this state when it comes to public health?
Yeah, so we're very concerned about the race data. And Vermont is similar in some ways to other states in that we've had a higher rate per capita, if you will, for the African American population. Fortunately, we don't have abundant poor outcomes, and statistically, we can't really show too many comparisons in that, as we've only had as a state 55 deaths total out of the almost 1,000 cases that we have right now. But obviously, very, very concerned about this. We know that there are historic reasons why African Americans may be at more risk of not only having a poor outcome perhaps, but of contracting the condition in the first place. And these go back to major issues of historical injustice, racism. There are aspects of the healthcare system vis-a-vis its interaction with people of color. There are abundant theories. We don't actually know for COVID which one may be more important than the other, but I suspect it's a very multifactorial process that explains why African Americans and other people of color have not fared as well in the COVID epidemic as the non-Hispanic white community has.
Mr. Ford, I'm going to bring you in here. We understand Dr. Levine addressed early on that it was important with people with heart attack symptoms to still get treatment. Are you hearing from people still too nervous to come to your hospital?
Yeah, we did at first, and we were very concerned because our emergency department director and staff were saying that, even for the acute strokes and cardiac conditions, they weren't seeing that early on. By and large now, I think people in Rutland County have been comfortable coming back into the hospital, coming back to their physician's offices, and getting the care that we've had to postpone and put off for them. So we haven't seen a lot of that, and I think we've done a lot of work to try to reassure them and make sure that they feel safe when they get to the hospital, especially if they're immunocompromised or so forth.
Sure. This next question for both of you, when it comes to stress, we know our mental health often affects our physical health. First off, Mr. Fort, to you, is this a big concern that you're seeing being presented in the hospitals? Even some of the primary care physicians asking their patients about just, how people are feeling right now.
Yeah, we were concerned from day one about the impact of that and the stress on people. And we are continuing, that concern is actually growing. We've tried to put in place, first and foremost for our staff, a series of supports. We've reallocated some of our clinical social workers to help work with our staff and be present and be able to help counsel them and provide some support for them. We've got a great wellness service that we've encouraged our staff to use, and we've gone out and proactively reached out to them, put on some educational programs for them on how to cope and how to deal. As far as patients, it's a little early to tell as we start seeing them continue to come back into the hospital. I know initially they were very concerned and very stressed, and they were avoiding coming to the hospital. Mm-hmm. But I imagine this is not just this is going to be a long-term problem that we're going to deal with as we face the long tail of the aftermath of this crisis.
Dr. Levine, that's a good point. This is just as difficult as doctors, nurses, regular staff at the hospitals as it is for everyday person just trying to live, with one day being up and around, going out and about, and basically the state closing down the next.
Very much concerned. If I could combine your two issues that you brought up, there's a paper that literally just came out today from the Morbidity Mortality Weekly Report showing that emergency department visits declined 42% during the pandemic. That's a huge, huge amount. Not all of that is for physical distress. Much of that would be for mental distress as well. So we have to keep that in mind. People were not accessing the healthcare system because of fear of the virus, and many mental health issues may have gone unattended. That's not even to begin to consider the impact mental health-wise on the caregivers themselves. Mm-hmm. And if you looked at some of the scenes from the New York City emergency departments and New York City hospitals, the staff were just heartbroken at their inability to help so many of the patients, their inability to bring loved ones together with patients at the end of life, and they were left in the role of holding the hands of the patients themselves when they had run out of other options. So it's been proposed by many in the field that there will be a second pandemic, but the pandemic won't be COVID, it will be the mental health repercussions from COVID. So we have to take that very seriously. Here at the Agency of Human Services, the Department of Health is working closely with the Department of Mental Health and other parts of our agency to really begin the planning for how we can cope with this proposed resurgence of mental health issues, and the fact that so many who have had mental health issues have probably not had them as well attended to as they could have during the pandemic.
Yeah. Something we can't forget as we move forward in the next few months, at the end of the year, et cetera. Dr. Mark Levine, Claudio Fort, I really appreciate you addressing the healthcare aspect that again has led our lives for the past 3 months. Thank you very much.
Thank you.
Thank you.
Coming up on Friday, Governor Scott expected to announce changes to the quarantining rules when it comes to people visiting from out of state on a platform basis. We'll say to see how that works. Also, news when it comes to restaurants to once again come back inside for that indoor dining experience. A lot of us doing curbside dining and outdoor dining for the past week or so. When we come back, education. What will classrooms look like in the fall? What will colleges do? And is remote learning here to stay?